So there's dentists that do sedation in relation with anesthesia providers, and there's dentists that don't do sedation in relationship with anesthesia providers. The common thing amongst both of them is, one, gain more experience in training yourself so that way you better understand what's going on with that patient while they're under general anesthesia, to use that as an example. To put yourself in the shoes of the anesthesia provider. Fortunately, big majority of the times as anesthesia providers, they'll actually use an advanced controlled airway for good, obvious reasons, because that anesthesia provider is now bare minimum 5 feet away from that patient's head, and they don't have direct, exact control over how much water and how much moisture, blood, whatever the case may be, foreign objects, fractured tooth structures, you name it, drop drivers, the list is long. Those are all very scary things, directly, potentially negatively affecting the airway and, of course, the outcome of treatment for that patient. So we have to respect that. We have to respect what the anesthesia provider is going through. And then on top of that, I think that it can only help that relationship if us as GPs, we had a solid understanding of the requirement for space and the requirement for recovery and the need for organization that each provider has in their office, and try to cater to it. And I can only imagine, I would love to hear from the anesthesiologist, but anytime I've ever had an anesthesiologist in my office, I want to do everything I can to make their experience smooth, comfortable, feel like they have everything that I could possibly provide for them, because I want them to want to come back. And I also want to make sure that they're not having to worry about anything facility wise. They can just relax, focus on my patient at hand, and make for a good experience for my patient as well.